Hi, Dr. Moses. Nice to meet you.
Hi, Dr. Bindia, and really nice to see you here in Dubai.
Likewise, I was very pleasantly surprised, when I think last month we were just checking, like, where are you? And you mentioned you're in Dubai.
And I've moved my family.
Ooh, lovely, because I have very fond memories of you as my registrar guiding me through when I was in Barnsley. How long ago was that?
That was, oh my God, it's now going back years, but that was, I think, 2007. Yes, you were my SHO at that time when we were both really at the start of our careers in obstetrics and gynecology.
Wow, gosh. So, what all has happened between Barnsley and moving to Dubai?
Since 2007, I became a consultant in obs and gynae in, I think, 2013.
Wow, lovely.
And then I made the decision to go back to university, actually. I became a research fellow at University of Oxford
Brilliant.
in obs and gynae, and I did a master's by research in infertility.
Excellent.
And then in 2016, I went into private practice, IVF clinic in London, and I stayed in the private sector through the big dip during COVID. Got married in 2023. And
Congratulations.
then, thank you very much. And then we decided to move to Dubai last year. So we arrived in Dubai in August. We're settling down. We're really enjoying life out here in Dubai. I know the place. I'm setting up a private IVF clinic here, Moosa Medical Group, and under the umbrella of Gulf Drug. But it's a big new adventure for me and my very young family. But we're enjoying it. We're enjoying it so far.
So, I mean, with all these, masters and going to Oxford, I would say you're a guru in fertility. And if you moved to Dubai last year, bringing in new perspectives. So, what are your thoughts? You see more and more women across the world, including the UAE, Abu Dhabi, Dubai. I'm working in Yas Clinic Hospital in Khalifa City, which is an Abu Dhabi Stem Cell Center. And I have so many women who ask me about egg freezing. So from your perspective, really, what's driving the shift for women to be suddenly so aware about egg freezing?
You mentioned two things. One, awareness, and two is requesting it. There are definitely more and more women asking about egg freezing and actually going through and carrying out an egg freezing cycles. Several factors have contributed to women asking about exploring egg freezing and asking for this to be done for themselves to preserve their fertility. If you look at our parents, and this is saying a bit about my age already, but 50 years ago, the average age of a woman having her first child in the USA was 21 years old. That has dramatically changed, and now in 2020, when the most recent surveys were done, the average age for a woman having her first child in the USA was 30. That average age has moved up by 10 years, and that has a huge amount of implications. Whereas women are born with all the eggs they ever carry. On average, a woman is born with about 2 million eggs. By the time she hits puberty, she has about 500,000 eggs.
Yeah.
She actually loses anywhere between 100 to 1,000 eggs per cycle.
Yeah, and this is something that even patients are very worried about when they discuss with me. As you know, Yas Clinic in Khalifa City is the center of bone marrow transplant excellence. So what that means is I have got young girls, I've got young patients, I've got women in their middle ages. And when they come and see me in the gynecology clinic, they do ask, what can I do to preserve my fertility? Partly because, of course, the medical condition that you mentioned.
Actually, and you've actually touched on a very, very good point. When I started my training, and this was 2009 in infertility, vast majority of patients who are having their eggs frozen, it was for medical reasons. I'd say almost 90% of the patients I saw were freezing eggs because they had been diagnosed with some form of cancer, especially, or perhaps conditions such as sickle cell anemia.
Yeah.
And they were going to have some kind of irradiation therapy or chemotherapy or radiotherapy, which might affect their fertility, that after their fertility, they may be infertile or have reduced fertility. And so at that time, the patients my patients were having fertility preservation because of an underlying medical cause.
Right.
That has changed dramatically. And now, literally 95% of the patients I see are freezing their eggs for social reasons.
Wow.
They're not yet ready to start a family. They don't have any underlying medical condition. It's not that they're infertile. It's either A, they haven't met Mr. Right.
Yes. Yeah.
Okay? They're still waiting to find the right partner to start a family. They want to advance their careers.
Yeah.
They want to climb up the corporate ladder. They don't want to start a family yet, but they want to preserve their fertility. Also, there are others who want to get more financial stability.
Yeah.
The world is becoming more expensive. It's more expensive to buy a house. It's more expensive to buy a car, to go to work. Childcare costs are rising. They want more financial stability before they start a family.
Yeah.
So for all these reasons, women are holding off starting their family, but they want to preserve their fertility. They do want to have children, but it's just that they don't want to have those children immediately. They want this plan B for in case they have difficulty getting pregnant later in life, when they have met Mr. Right, or when it's an opportune time in their lives, that they can still, if they have difficulty conceiving and getting pregnant naturally, that they can then bank on these eggs that they have frozen.
Absolutely. It's like they want to start a family at their terms and condition. How can you explain to patients what really does the process of egg freezing involve for them?
Egg freezing has evolved as our understanding of the woman's cycle, our understanding of how to interact with women's hormones has evolved. And nowadays, an egg freezing cycle takes on average 12 to 14 days from the start of a woman's period. And it normally involves taking one injection once a day for 10 days and having anywhere between 3 to 4 scans during that time. Normally, a scan on the first day of the menstrual cycle, on the 6th day, on the 8th day, and on the 10th day. And these scans are to see how the follicles are. Normally, in a menstrual cycle, one egg grows. We call it the dominant follicle.
Okay.
But with these injections, we get any number between kind of 10 to 14 eggs to grow, and we monitor them to see how they're growing through the cycle. We sometimes do some blood tests.
Okay.
And then when the follicles are the right size and also the bloods are reflecting that we have good mature eggs, a woman takes a trigger injection and we do an egg collection roughly 2 days later.
Okay.
And this could be on roughly day 12 or day 14 of the cycle.
And is it painful?
Some women may find the injections a bit uncomfortable. The injections are very, very similar to the insulin injections that people with diabetes may use. They're not that painful. The actual process of collecting the eggs is done under sedation, conscious sedation. It lasts maybe about 15 to 20 minutes. And the woman only needs to stay in hospital for maybe 1 to 2 hours. And then she's able to go back home that same day. And most women are even able to go back to work the following day. So it's a very quick process. It has evolved a lot. This is what we call a short protocol.
Yeah.
Or its proper term, the antagonist protocol. But this has changed a lot from what was traditionally the more common, maybe about 15, 20 years ago, which was the long protocol, which or down regulation agonist protocol, which required putting a woman into a temporary menopause over about a week to 3 weeks, followed by 2 weeks of stimulation. This was many women found this very tiring. There were mood swings involved, putting her into a temporary menopause. That some of them would get temporary hot flushes, cold sweats, the mood swings, and they found it unpleasant.
I remember when I was in Southampton, maybe 2010. And we were using long protocols, and it was very tedious for women to keep coming back to the fertility center. And now, when everybody wants a quick fix for everything, I think that the 12 days, as I gather, would really work out well for these patients. And how do you do the egg freezing? What I mean is it through the tummy? Is it transperineally, so through the back passage, through the front passage? Or, I mean, what is your expertise that women could be guided to?
Okay. As I've developed through my career, my practice has also evolved. And you've actually brought on a big topic about what are the reservations or sensitivities women have about the egg freezing process. Vast majority of the monitoring through the cycle and even the egg collection traditionally and more commonly across the whole world is done transvaginally. So initially, to even assess the woman's fertility, to even assess the access to the ovaries, it's done via transvaginal scan. And when we do the egg collection, it's also done transvaginally. Now, actually, when I moved across here to Dubai, I was actually approached. I've been approached several times and carrying out a transabdominal approach because many women find a transvaginal approach very sensitive.
Yeah.
Many women in the Middle East have never had a sexual partner.
Yeah.
And they find it very intrusive to have any kind of a transvaginal approach. Now, during my time in Oxford, we were performing ultrasound guided transabdominal egg collections, and this was primarily for medical reasons. These were on women who were either born with vaginogenesis, they did not have a vagina,
Yeah.
or even they had rectal genesis, they had no rectum. And the very first transabdominal egg collection I actually performed was on a 28-year-old lady who was married and wanted to start a family with her partner, but there was no vaginal approach that could be done. We had to do our egg collection transabdominally, collect all the eggs, fertilize them. She had a uterus, although she didn't have a vagina. She had a uterus, and we even had to transfer the embryo transabdominally into the uterine cavity, and she got
Wow.
pregnant. Now, then when I moved to London, there was a large multicultural population with a lot of Afro-Caribbean women who had fibroids.
Yes.
So their uteruses were enlarged and their ovaries were high up in the abdomen rather
Yes.
than down in the pelvis.
Yes. Yeah.
So again, my practice evolved, where I started using my transabdominal approach to access the ovaries much easier and safer.
Which is a welcome news for women out here. I mean, it's less intrusive to go abdominally. Is there any cutoff in terms of BMI or, let's say, the obesity factor that would limit the use of egg freezing, egg collection transabdominally?
I think the only factor would be if the access is difficult. Actually, one of the reasons why I also do transabdominal egg collections is because of raised BMI. And these are women with raised BMI, and again, their ovaries are high up in the abdomen, and you can't easily access them transvaginally.
Vaginally, yeah.
So actually, we monitor these patients during those first 10 days when we're scanning the women. We are also able to do transabdominal scans to monitor the follicle response to stimulation. And we're able to see whether the access will be easy transabdominally. Mm-hmm. And so, I'd say the only contradiction to doing a transabdominal egg collect is if you have very difficult access to the ovaries, and you're able to assess that during the stimulation.
And what are your thoughts, let's say, if a patient has had abdominoplasty and she's had multiple surgeries to her tummy, so a lot of scar tissues is expected. So in your practice, have you encountered any difficulty in trying to collect the eggs in these patients? Or it's something that you are quite, you could easily do this procedure as well?
Patient selection is important.
Yes, of
and,
course.
and so it's always about choosing the right patient to do the right procedure.
Yeah.
And in my experience, it's actually a transabdominal egg collect for patients who have had a lot of complex abdominal or pelvic surgery. It's actually easier.
Okay.
Because
Yeah.
the ovaries are stuck. Normally, they're stuck to the abdominal wall, and that actually makes access easier transabdominally. You can scan. You can do a scan during during the stimulation, see where the ovaries are, and then again when the patient is sedated, scan and see what the access is like. And so for me, it has actually been easier to do transabdominal. And I even have colleagues of mine who have taken similar patients to theater to do a transvaginal. When they're trying to do the transvaginal egg collection, they can't access the ovaries easily, and have actually had to convert from a transvaginal to a transab because it's easier that way.
Do you think women worry about any stigma when making this choice?
There is a lot of stigma and judgment from women, from society in general, about women putting off having children early in life. But I think it's about egg freezing is about leveling the playing field. Men for a long time have started their families when it's convenient for them, when it's the best time for them. Women should also have those choices.
True. Yeah.
Yes, society is judgmental, but egg freezing action, and it's judgmental because they want women to have their children early, or to at least have because even society knows that the older woman is, the more difficult it's going to be for her to have children.
And even if they do fall pregnant, even spontaneously, later on there are lots of medical, it becomes a very complex scenario for them to continue the pregnancy.
There are more and more complications with pregnancies at an advanced age. That is very true. But so too have been the advances in obstetrics and gynecology. Doctors know how to monitor these patients better in pregnancy. Yeah. There are more intervention. There are more medicines that are available. I remember when I was starting my career, it was, if you had a patient over the age of 40, oh my God, this is a patient over 40, how are we going to look after her? And
yes.
Now it's like, patient who's 42 years old and pregnant, that's like...
that's a norm now.
No, it's a norm. There's no issue. No one is really bothered about that. They're now confident of how to manage and look after her. This is all evolving, and medicine is becoming better to look after our population. And that's what medicine is about, looking after our population with the health needs that the population brings to us. If it's women becoming pregnant at a later age, we have to make sure we provide a safe environment for them to carry these pregnancies at that age.
What is the average cost, and how a person living an expensive lifestyle, we know that it's very expensive to live in Dubai and Abu Dhabi, how should they budget it? Like, what's the average cost they should put aside for egg freezing?
The average, I'd say here in Dubai and in Abu Dhabi, the average cost of an egg freezing cycle is anywhere between 15 to 20,000 dirhams.
Wow, that is quite a bit.
That can be expensive. But it also depends on the circumstances and the clinic. Some patients are having more than one cycle because maybe they have a low ovarian reserve, or because of advanced, and they want to get enough eggs to store in case they're needed to build the family of their size.
Yeah.
It depends. Some women just want to have one child. Some women want to have at least store enough eggs to have 3 or 4 children in the future, should they require them. Because a very, very important point about egg freezing is, what are the future plans of this patient? If she's 34 years old and wants to do egg freezing and only plans to have one child, then she may only go through one cycle and collect 8 to 10 eggs, and that would be enough of a backup plan for her. Whereas it could be completely different if that lady is maybe 40 years old and is planning on having 2 children.
Yeah.
A double one is that she has reduced ovarian reserve, where she may only be able to get 4 or 5 eggs per cycle. So such a lady may require 3 cycles, may need to go through 3 cycles of egg freezing to get the to give her a good number of eggs to achieve her plan in the future should she require these eggs to have a baby.
So, Moses, is there an ideal age range for egg freezing?
The best age for women to freeze their eggs is before their 35th birthday.
Okay.
And the studies also show that a woman will need on average 6 eggs to freeze an average of 6 mature eggs to give her a high probability of having one child from these frozen eggs in the future. What we've also seen in practice is the average age of patients coming to freeze their eggs about 38 years old. Most women we're actually seeing over what is thought of to be the ideal age. And so this is where things like this become important. It's about raising awareness to women so that they can come in actually before their 35th birthday to freeze their eggs if they've not yet embarked on starting their families.
And is there any age on the lower side that you wouldn't propose egg freezing? For example, we have the prepubertal girls, and what is your advice to them? Would you stimulate anybody below the age of 16, for example?
There are 2 issues you're now touching on with that question. One, when is the lower age limit for social egg freezing? And I'd say with our clinic, it's 18 years old. If you're over the age of 18, we have considered that above the age of consent. You can freeze your eggs for social reasons that you want to preserve your fertility. Under the age of 18, we would only carry out egg freezing on medical grounds. So this would be like young women who have been diagnosed with some kind of cancer, or they are going to have a irradiation of their full body radiation. For example, the women you see at the Abu Dhabi Stem Cell Center who are going to be treated with bone marrow transplants for sickle cell anemia or similar conditions. And as long as these young females are having menstrual cycles, you can stimulate them in order to collect their eggs and preserve them. However, for prepubertal girls who are not having any periods, we can't stimulate because they just don't have the receptors. And in such women, you then consider ovarian tissue preservation. And actually, I remember seeing one of the on LinkedIn. Your center had been involved in, I think, the first ovarian tissue preservation case here in the UAE, and congratulations on that.
Thank you. I had the opportunity to be involved in the process, and 7-year-old girl, we removed her ovary and we have frozen it to be used later on. Moses, that leads me to asking you to raise awareness for our patients. What are the risks that are involved in egg collection? Both the short-term risks, and are there any long-term risks?
With egg freezing, I think the main complication or main risk, especially in young women with a very good ovarian reserve, is a complication known as ovarian hyperstimulation syndrome, or OHSS is the abbreviation.
Yeah.
And the reason for this is the ovary is about the size of a strawberry, okay? And normally you release one egg, which is small, tiny. It's less than, you can't even see it with the naked eye. Yeah. But the follicle may grow to about 2 centimeters in diameter. When we stimulate a woman to do an egg collection, the ovary can grow from the size of a strawberry to the size of a large, the Florida oranges.
Oh yes.
Okay, which is quite large, and that
large,
so you can have 2 of those in your, and that would be more or less close to ideal stimulation, whereby you're collecting anywhere between 12 to 16 eggs in that cycle. However, with women with a very good ovarian reserve, they're very sensitive to the drugs we use to stimulate. And sometimes the ovary can grow from the size of a strawberry to the size of a soccer ball, which is massive.
That is massive, yeah.
Yes. So it can cause a lot of pain and discomfort in the abdomen, But the main issue with this is what we call a fluid shift, where a lot of fluid accumulates in the woman's abdomen, and this can cause a lot of dehydration for the woman, and can lead to clotting disorders like deep vein thrombosis or even pulmonary embolism, which can be quite serious. This is why there's a lot of monitoring during the cycle. We're scanning the woman on day 1, day 6, day 8, day 10. We're measuring her estradiol levels. Many people have changed their approach. They're no longer using high dose stimulation. They're using lower dose stimulation to try and minimize the risk of this happening.
So basically striking a balance that our patients don't end up with serious complications, which, if I recall, is less than 1% critical OHSS.
All kinds of stimulation leads to a degree of OHSS, and you've touched on the right thing. When is it serious? So there's always mild and moderate, but what would call serious to critical is less than, I'd say, 3% of all women going through some sort of stimulation.
It's good to be aspirational. Keep your eggs as you would keep your money in the bank until you're ready to embark. You understand the pros and the cons. Of course, it can be a financial burden, but at the end of the day, it's a trade-off, really. Serious risk, as Moses has mentioned, is less than 3%. And on that note, I would say it's good that more and more women are asking for this. They know that there are options and choices. So thank you very much, Moses.
Thank you very much, Bindia, for sitting here with me and discussing egg freezing, and looking forward to more discussions.
Sure, and looking forward to guide my patients to come your way.